Sometimes when you're sitting in a very room tight where there's no proper air circulation and you feel suffocated, and when you go out and put your body in where there is a gentle breeze, cool breeze, you feel so relaxed. Ayurveda views sunlight as a therapeutic input that supports warmth, grounding, and it brings stability. That is what we call in Ayurveda the Atapa Seva, or exposure to sunlight in a controlled, comfortable environment. Most people notice better energy, better immunity, the bone strength gets better, and overall their mental health gets so much better. In today's episode, we explore a deficiency that often goes unnoticed but quietly affects energy, immunity, bone strength, and even mood, your mental health, and that is vitamin D3. Through the combined lens of modern science and Ayurveda, we will look at why sunlight is not just a lifestyle choice but a therapeutic tool, and how practices like Atapa Seva and simple daily routines can help your body restore balance naturally. This is a grounded, practical conversation about healing through consistency, sunlight, and supporting the body the right way. Hope you enjoy this episode. A very warm welcome to all of you to Ayurvedic Healing and Beyond podcast, and this is your host, Dr. Vignesh Devraj. Now, today I want to talk about something many of us deal with silently, and that is the vitamin D3 deficiency. Now, we'll discuss how vitamin D3 is impacting the energy, immunity, bones, and most importantly, the mental health. Now, how some simple practices, including in what we call in Ayurveda as Atapa Seva, which actually is loosely translated as controlled exposure to sunlight, and how that can help your body to recover. Now, if you look at the history, vitamin D deficiency was identified through the story of the disease called rickets. Now, children in industrial cities had weak and soft bones. So, doctors noticed children who played in sunlight recovered quicker. Now, later they found out there is a missing factor in their blood, and that factor was vitamin D. This is when sunlight formally became part of the medical understanding. In Ayurveda, therapeutic exposure to sun is called Atapa Seva. Now, this falls under the treatment approach, what we call as Shamana Chikitsa. Now, if you see the word Shamana, it sounds like a very difficult or technical jargon in Sanskrit. But if I have to put it in a very simple language, the word Shamana refers to a set of Ayurvedic practices traditionally used to ease and relax the body and the nervous system. See, it helps to relax the body and calm the nervous system so that the body is in a better state to heal. See, in one of my previous episodes, I spoke about the 3 R's of healing. That is, to relax, to reduce, and to replenish. And the first one is what we call as relaxation. And that relaxation, that is to relax the body and the nervous system, this is exactly what Shamana stands for. Now, Shamana is recommended when the Vata and Kapha are very high, and on top of that, when the body is not ready for a strong intensive treatments. So, on one hand, you want to calm the Vata and Kapha, but when the body is very tired, in these conditions, this is when Shamana is very apt. So, the Ayurvedic textbook, like in Ashtanga Hridayam, it explains the few therapies that falls under Shamana, which is Langanam, Pajana, Deepana, Atapa Seva, Maruta Seva. So Langana, in simple terms, the word Langana is one of the first parts of Shamana, which actually means letting go of the heaviness in the body so that the body becomes light again. So which actually means, to eat little or eat not more than what you used to eat, reduce your portion, and then rest more so that your body and the nervous system can really relax and reset. Now, there is this concept of therapy called Pachana, which actually means digesting what is stuck inside. And it also means not just physically, also mentally. And there is this word Deepana, which actually means to boost your inner fire or like your metabolism. So the most important Shamana protocols, which includes to make sure your body is relaxing, to give body a break from all the things that made it very heavy and tired, improve the digestive power, improve your metabolism. And on top of that, it talks about Atapa and Maruta Seva, which means to expose your body to sunlight, which is comfortable, and expose yourself to the breeze. Sometimes when you're sitting in a very room tight where there's no proper air circulation and you feel suffocated, and when you go out and put your body in where there is a gentle breeze, cool breeze, you feel so relaxed. So in Ayurveda, exposing to sunlight that is comfortable and exposing to the breeze that is very comfortable is part of relaxing the high Kapha and Vata. Now, in simple instructions, Ayurveda views sunlight as a therapeutic input that supports warmth, grounding, and it brings stability. Now, modern science also shows sunlight influences your circadian rhythm and it also impacts your mood regulation. That is why in some countries we see higher depression during the winter months because the lack of exposure to the sunlight. And also we hear people, when you travel and you're jet lagged, one of the best hacks to overcome your jet lag is to go and expose yourself to the sunlight. So this corrects your circadian rhythm in the new time zone. So we have two different frameworks pointing in the same direction. Now, if I have to bring the modern science angle, vitamin D works it's like an analogy that I can give. Vitamin D works like a strong supervisor in a construction site. And imagine the calcium or phosphorus or proteins are the workers here. Now, without a good, strong supervisor, the workers do not know how to build strong structures. There is complete chaos. And there is no harmony and there is no teamwork. So what happens? Your bones become weaker, your muscle recovery slows down, immune regulation also becomes less efficient. And most importantly, the mood or the mental health becomes unstable. Research, we have multiple research which talks about how vitamin D deficiency, we have multiple research which talks about how vitamin D deficiency is associated with higher rates of respiratory infections, lower immune regulation, higher inflammation markers, greater severity in autoimmune conditions like multiple sclerosis, and higher rates of depression and anxiety in those who are deficient. I've seen multiple patients coming with multiple sclerosis and they mentioned that after they started supplementing vitamin D, the flare-ups that used to trigger during different types when they are stressed out or when they don't have enough sunlight, when the vitamin D is properly supplemented and all the other patterns that they follow so that the vitamin D is much higher, this reduces their flare-up in certain autoimmune conditions. So what vitamin D does is it enhances the intelligence of your immunity. And that is what goes down in autoimmune conditions. And also vitamin D receptors are present in the hippocampus. That's a part of the brain which is responsible for mood and memory. So low vitamin D also influences serotonin pathways, which explains why people feel low in their mind and body when their vitamin D is on the lower margin. See, many studies show that correcting vitamin D deficiency can improve mood, like mental health, in people where it is very deficient. So this is an important point. The benefit is strongest when deficiency is present. Now, let me give you a very practical framework from Ayurveda and from the modern science. Sunlight and stable routine matter. That is what we call in Ayurveda the Atapa Seva, or exposure to sunlight in a controlled, comfortable, environment. It is not about tanning or burning your skin. It is about controlled exposure while it is still safe for the skin to get exposed. So you step into the sun at the right time. You allow gentle warmth to reach the tissues. That is when the body produces vitamin D. This will relax the nervous system. Your sleep rhythm will reset with natural daylight. Now, these are the same outcomes we want while calming the high vata. So, if I have to break it down, the first step, do a blood test and get your vitamin D levels tested. Let's see what it is. Is it sufficient, it is insufficient, or it is very deficient? Understand what is your status of your vitamin D levels. Now, usually the values are measured in nanograms per milliliter. So, most adults feel good when it is between the range of 40 and 60. So, if I have to look at people with autoimmune conditions, I have always observed when, especially patients with multiple sclerosis or certain autoimmune conditions, when they are able to up the vitamin D level markers between 50 and 70, that is when the flare-ups are very less and they feel their life is as good as normal. Okay, that can be an overstatement, but this is something I've seen in my patients who come for multiple sclerosis therapy in Ayurveda. Now, the second step, therapeutic sunlight, 10 to 15 minutes a day. Go when your shadow is shorter than your height. That is usually between 10 a.m. and 2 p.m. Avoid sunscreen. The idea is, don't let it expose so much so that you get sunburned. Be careful. No, and be very intuitive. See where you feel. The moment it gets uncomfortable, step out. Come out of it. Don't get any sunburn injury. Now, step 3 is about what we call in the Shamana therapy, which is routine. Eat warm and easy to digest food. Do less. Make sure you're consistent with your timing for eating and sleeping, and avoid heavy laziness. And make sure you do some good oil massage 2 to 3 times a week. You see, when your vata is balanced, your body's ability to absorb the right nutrients and minerals get better. And that is what we do here. And step 4, combine vitamin D3 with vitamin K2. We have a lot of studies which talks about See, vitamin D helps your gut to absorb the calcium, and vitamin K2 makes sure this calcium that is absorbed is directed to the bones and the teeth. So without vitamin K2, the calcium can deposit in the wrong places like your soft tissues. So that is why it's important to always combine vitamin D3 and K2. And please do check the dosage with the right qualified practitioner. And step 5, make sure you move daily. Make sure you walk, do some strength training, do yoga. Make sure your body is moving. See, your bones respond better to vitamin D when you use them. So movement is very paramount here. Last but not the least, this is one thing I always recommend. Whenever I see a very, very low vitamin D, one of the first questions I ask my patient is, how is it with your alcohol? And have you tested your cholesterol as well? So alcohol slows the liver's ability to activate vitamin D. So even moderate drinking can impact this. So I always tell people, please give up alcohol. It is not healthy for you. And also, your body uses cholesterol to make vitamin D from sunlight. But healthy liver function is essential for this process. Fatty liver or very high oxidized cholesterol can interfere in this process. So correcting cholesterol and making sure your liver health improves, this is how your vitamin D works better. Please stop alcohol and make sure your cholesterol is also balanced. See, vitamin D is like your body's construction supervisor, like I said before. When the supervisor is present, things are built properly, there is harmony, and the bones, mood, immunity, recovery all work in good harmony. But when the supervisor is missing, the workers get confused, there is chaos. So whether you look at this through Atapa Seva or Shamana therapies or through modern nutrition, the message is same. Sunlight matters, routine is important, good digestion is very important, and consistency is the underlying factor. So if I have to sum up, correcting your vitamin D is not just taking the supplement that you get in a pharmacy and you hope for the best. See, it's about preparing your body so that the supplement that you're taking is actually working in your system. And over time, your body maintains healthy levels naturally and you don't have to take these supplements on the long term. Now, try following these protocols for 3 months. Most people notice better energy, better immunity, the bone strength gets better, and overall their mental health gets so much better. Thank you for listening. And if you wish to consult me or an Ayurvedic physician trained under me, the link is in the show notes. Please do subscribe and share this with someone who may need it.